Okay.
So welcome everyone to this webinar on making cities belong to those who build them towards a more inclusive urbanization. We have a wonderful group of panelists today who will share their reflections and comments on this theme. And also, I would like to thank the participants who have joined us. Apologize for a slight delay in beginning the session. So at the outset, I'd like to say a little bit about the Bahá'í Chair. The Bahá'í Chair for Studies in Development is an endowed chair at 𝗏𝗿𝗬𝙗𝗍 𝘗𝗵𝑔𝑉𝑖𝑑𝑦𝑎LAY, Indore, established to promote interdisciplinary research and scholarship on social and economic development based on a vision that regards enduring prosperity as an outcome of material and spiritual progress. The chair explores concepts, methods, and approaches to development that are based on the principles of justice, the oneness of humankind, and the interconnectedness of human life with the natural world. This webinar is the first in a series organized by the chair to explore the social and economic crisis caused by the COVID-19 pandemic to vulnerable and marginalized populations in India's urban and rural areas. As we know, the COVID-19 pandemic in India led to the return of around 22 million people from the cities to villages and small towns. This mass exodus has been compared in magnitude and scale to the mass movement of peoples in the subcontinent during the partition. Millions of people migrate to Indian cities to work in the urban informal sector, in industrial zones and middle-class homes. Most of them come from historically disadvantaged castes and classes who migrate to the city to escape agrarian distress, the caste system, patriarchal norms, and the lack of employment opportunities. In cities, they are given low-paying jobs without basic social protection, such as adequate food, nutrition, healthcare, housing, water, and sanitation. Their jobs are not covered by formal contracts and are often outside the reach of the law. Rapid urbanization has been long held to be the route a country takes on its path to economic growth and prosperity. Thus, large-scale rural to urban migration was expected to alleviate the poverty of rural populations, who it was expected would reap the benefits of urban economic growth. Yet what India witnessed in its cities in the past couple of decades was what the World Bank called messy and hidden urbanization. Millions from rural areas poured into overcrowded cities, which lacked the infrastructure to provide basic civic amenities or housing to such large numbers. Cities expanded as a result of this uncontrollably. This influx of people joined the urban informal sector, which is estimated to employ around 450 million people. This workforce remains hidden because those employed in it are not formally recognized as citizens or workers, lacking legal employment protections, rights, and guarantees. This unjust face of urban India that has been glaringly exposed by this pandemic raises important questions about the human dimension of urban development. Clearly, a more sustainable, prosperous, and peaceful future for our cities will require urban development to be recast at the level of conception, policy, and practice to take into consideration the realities of the urban poor, not only what they lack, but also what they have to offer. Those who belong to this segment of society no doubt live in a state of acute want, and there is an urgent need for legal frameworks and policy interventions to create just, safe, and wholesome living and work environment conditions for them. However, development thought will have to transcend paternalistic ways of thinking about the poor if their true potential as human beings living rich and complex lives is to be tapped. Numerous studies carried out in the past 2 decades among slum dwellers and workers in the informal sector have highlighted their creativity and ingenuity, the strong social bonds that exist between them, their ethic of mutual support and collaboration, and their spiritual convictions which give them joy, hope, and resilience in the face of dire circumstances. Structural and systemic changes are no doubt urgently needed to create conditions for these oppressed populations to prosper. Yet to define victims of oppression by the circumstances of their oppression is to deny them their full humanity. It is thus in acknowledging the intrinsic value of the social, cultural, and spiritual aspects of their lives that one begins to view this segment of society not just as a source of labor or as a bundle of wants and needs, but rather as potentially valued contributors to the richness of collective life in cities. So it is hoped that this webinar will help us explore some theoretically and empirically grounded insights that show a way forward towards a more just and inclusive form of development for our cities. Before going on to introduce the first speaker of our webinar, Professor Kundu, I just wanted to make 2 points. In between the presentations, after the third presentation, we will have time to take questions from the attendees. So you are requested, those who are participating in this webinar are requested to share their questions for the panelists through the Q&A menu that you have on your screen. Also for the speakers, since we have a distinguished and very valuable group of speakers who have assembled today, and we want to listen to all of them, giving each one adequate time. Speakers are requested to try and stick to the allotted time of within 15 minutes for each presentation. And in case there is always going to be cases where we go beyond the time limit, I have the unfortunate task of reminding you, which I will do by sending you a small comment in your comment box. Our first speaker for today's webinar is Professor Amitabh Kundu. Professor Kundu doesn't need an introduction. He's at present a distinguished fellow at the Research and Information System for Developing Countries. He's chairing the committee overseeing the survey of Swachh Bharat mission in rural areas. He was a regional advisor on poverty at UNESCWA during 2017 and a consultant to the government of Sri Lanka during 2016. Until January 2014, he was professor at the Jawaharlal Nehru University. He has been Dean of the School of Social Sciences and has served as a member of the National Statistical Commission during 2006 to 2008. Professor Kundu, I will put your PowerPoint on the screen as well.
Am I audible now?
Yes, Professor.
Okay. Arash, thank you for this introduction, other panelists and the participants of this webinar. I must compliment the Bahá'í Chair and Dr. Arash Fazli for taking this opportunity of organizing this discussion on a very, very important subject. And I entirely agree with him that the pandemic, the basic argument that he gave, that the pandemic really did not make the informal workers and the migrants vulnerable. It brought out the vulnerability which already existed to the media, to the public view. It did not really fragment the society. It showed how fragmented we are. Some sections of the Indian population showed their patriotism and nationalism by staying at home, watching videos, films, reading books, whereas the other section had to struggle out in the open risk and run the supply system. Certainly, I agree with Arash's basic contention. The cities have not been very supporting of the informal workers. They have been unjust. Environment, regulatory system, the trade relationship, and a figure came from Arash, about 22 million people have gone back. But if you take the other informal travel arrangements made, my estimate is it would be something more than 30 million over the period. Some had to go back because the Kharif season sowing is to begin, but nonetheless, the exodus was basically because of the, the unfair cities which did not promise them safe employment for the period of lockdown. The way they were living, 30–40% of the people were sharing toilets, drinking water. Obviously, that is not very conducive for social distancing. It doesn't mean anything for them, and they had to go back. The issue that has been posed, let me come to that, whether the cities have become more favorable, have the cities, what has happened in the past 3 to 4 months? Let me focus on that. Has there been significant change in the data analysis situation, in the legislative system, to give an assurance to the people who have left, about 32 million? The total workforce in urban areas, as per 2011 census, was something like 134 million. I would project it now to be 160 million. And if 32 million went back, certainly it's about 20% of the workers who went back. Now the question is, will they come back? Have these cities become a little more welcoming than they were before, let's say, February 2020, then February, March 2020? Let me just, can we go to the next slide, please? I just wanted to tell you that first meeting that was organized at 𝗏𝑇i Aayog, where the deputy chairman and many other top-level functionaries were there. They wanted to know what is to be done about the migrants, what kind of economic activities need to be promoted. My first submission was that let's first arrange transport. Let them go back, because there are social, psychological reasons, and unless you take care of that, other things certainly would not come forward. But they didn't have the statistics. We did not know origin, destination, number of migrants. And Partho, you remember this graph has been taken from the migration report that the committee that you chaired. That is for 2001. I talked to the people in the census and also talked to IIPS. They have been trying to get the similar data for 2011. Unfortunately, we have not been able to build up. I'm talking about origin, destination, migrant, interstate migration data, that how many people are going from district A to district B, both in migration and out migration. So that is something that people, since they are talking about registration, we have legislation which will be protecting their interests, providing the basic amenities. We need the macro statistics. Unfortunately, the data have not been prepared even for the 2011 census data because of the boundary changes of different districts. That is something is a must, and I think there is some thinking which is going on to really strengthen the database as far as the migrants are concerned. I know I overstayed these 2 slides. I would go quickly. Next one, Arash. This is a data table which shows, the first one showed the total number of in migrants. Now this is showing the percentage of interstate out migrants for the males So out-migration data for each district for 2011 is not yet tabulated for all the districts, and that I think is the first point if you want to make the unorganized workers and informal workers and the interstate migrant workers, give them some kind of social security. That would be the first thing. The second point I would like to know, please go to the next slide. Now, we don't even know what is the number of workers out of this 160 million is the urban workforce, and I mentioned 32 million went back, which is about 20% of the workers who have gone back. Some of them have started coming back, and I think they pronounced loudly that they would never return, but that would not happen. We know that the rural economy cannot absorb even Manrega. The kind of jobs which are available may not be suitable for the migrants who have gone back. They are skilled people, but we don't have even the statistics. We have the data for unorganized sector. We have the data for informal workers. Even PLFS, Periodic Labor Force Survey data, which was initially not released, that does not give us exactly the number of workers who are not having any social security. So what I did is to find out the interstate migrants, how many of them are vulnerable, do not have social security. We don't have direct data, but I tried to estimate out of the regular workers. Can we go to the next slide, please? These are the state level figures. We find 48% of the regular workers do not have any social security. You may think that regular workers are all having social security. This is not the case. As far as casual workers are concerned, 82%, look at the bottom line, do not have any social security. And then as far as the self-employed are concerned, again, there is no data on that. I tried to derive it from the wages of the regular salaried workers who do not have social security, take that wage and impose on the self-employed persons, and we find, please go to the next one. The average earning of the regular workers who do not have any social security, which is at the bottom of the second column, 9,000 rupees is the average earning of those who do not have social security. I take that for the self-employed, and I find that among the self-employed, about 49.8%, the second column at the bottom, which shows that they do not have social security. Taking that figure into account, please go to the next one quickly. I did some calculation, I don't want to get into that, and I found out of the total interstate migrants, which will be something like 75, 78 million, we have 64 million of these interstate migrants who are in and around the big cities. Please go to the next one. And by using the NSS data and also PLFS data, I estimated, please go to the next slide, please, again, quickly. I don't want to get into the methodology. 43 million people who got economically destabilized among the migrants, and that's include 43 million that workers and their dependents. So first is there is a recognition in the government level for a database on the migrants, that because the registration is being considered and the access to various legal provisions will have to be done. So there has to be some proper information based district to district, origin, destination, and on their vulnerability, access to basic amenities. That is the first thing that I thought cities should be able to do. Let me go to the second part and I'll finish that quickly. What are the other changes have come up besides this data building up exercise which has started in the NITI Aayog? Can we go to the next slide, please? Yes, next slide. Now, the earlier one. Now, there have been changes in the labor laws. Are they really making the cities more welcoming for the migrants? As far as Uttar Pradesh is concerned, barring the provision of the Factories Act of 1948 and the Construction Workers of 1996, Child Labor Act, Maternity Benefit Act, these cannot be changed, Equal Remuneration Act. Excepting these basic provisions, also Bonded Labor Act, all the other labor laws have been suspended for 3 years in Uttar Pradesh. Now, you may welcome it because economy needs to be put on the right gear, but certainly to have that suspended for 3 years would not make these vulnerable workers more welcoming in the city. That's why the Madhya Pradesh is concerned. Basic contention has been the Industrial Disputes Act, which has been amended and been suspended for 1,000 days, which again is a serious matter, because many of these provisions of the Industrial Disputes Act and also the exemption given from the 1948 Factories Act would weaken the power of the working class in the future to negotiate and get a decent environment to work. Next one, please. Now, I quickly reviewed the legal changes which have come up in Gujarat. Again, you find basically number of hours of work has been changed, and the payment for the extra hours would be at par with the regular hours. There is no extra payment being made, and no facility for their accommodation, stay, and travel has been made. So you find Gujarat, Rajasthan, Himachal Pradesh, all the three states have gone in strongly for seeking exemption under the Factories Act and also the Companies Act. That really makes things a little more vulnerable. Initially I had welcomed this because I thought the economy needs to be put in motion, but I always argued that by November, December, there should be revisiting of the legislation so that we can see how it is affecting the vulnerable sections of the population. Let me tell you, all migrants are not economically vulnerable. Average consumption expenditure of the migrant, interstate migrant, is higher than the non-migrants. Similarly, in informal sector, there can be a doctor, there can be a lawyer, there can be somebody earning lakhs through a coaching class. You need to have data on vulnerability of the migrants and the informal sector. So these are the points I'd just like to conclude. Can you go to the next one, please? I just thought I'll bring in a little bit of history. In the aftermath of the bubonic plague in England, the Statute of Laborers came up in 1351. The plague killed something like 32% of the European population. Imagine the pandemic's impact. So that was 1348, 49, and 1351. We have the Statute of Laborers, which really suspended all, bargaining power of the trade unions and fixed the wages before the plague. And that wages were fixed, and laborers should not move out of the cities to other places. That's why the movement of the laborers were also restricted. But what happened? There were violations, but more importantly, there was resentment all over, and this was done basically to appease the industrialists. But the statute was a major contributory factor for the peasants' revolution in 1381 that broke parts of England, first popular uprising in the English history, which certainly required emergency correction. And it's only after the peasants' revolt this happened, and that made a tremendous cost for the economy and the society. Can we go to the next one, please? Now, in Indian context, we have in 2014-15, we had some relaxations in law in Rajasthan, Uttar Pradesh, Andhra Pradesh, and I looked at the data, what we get. Also, the Chapter 5B of the Industrial Disputes Act. That is what is being contested in the World Bank, and the IMF wants this Chapter 5B, which is really for the organized sector, to be changed. But that has not been changed happily. But that only covers only 7 or 8% of the total workforce. The rest of them are outside that, so the Chapter 5B or not, even if it is not changed, it doesn't affect. But the experience of these three states, Rajasthan, Uttar Pradesh, and Andhra Pradesh, shows that the relaxation of the laws only led to exploitation and the worsening of the conditions, although investment did come up. Similarly, Gujarat model of development, often treated as aspirational, was characterized by relaxation and non-implementation of many of the labor laws. But certainly that also attracted capital, but it led to less, capital-intensive growth of industries, and certainly that did not bring benefit to the workers and did not make the cities more welcoming. Final, can we go to the last one, perhaps? Now, there are two approaches. One is this German model, where you strengthen the working class through collective bargaining by strengthening the trade unions. But the second is this traditional social contract approach, where individual workers are empowered. In the Indian context, we followed a combination of the two. We tried to strengthen the working class, and also we tried to give individual workers some powers. But what we find over the past 10 years or so, the trade union powers have been weakened significantly, And certainly as far as the individual labor rights are concerned, that has not been touched much. But in the context of the present labor market in India, the trade unions, if they become weak, the individual laborers can hardly claim any rightful share in the total distribution of benefits. The 7-judge Supreme Court, Kishtimar versus State of Bihar, recognized that whenever an ordinance or new regulation is passed, like it has happened now in the past 4 months, they can be easily abused. This is the judgment of the 7-judge Supreme Court, that state ordinances and amendments are subject to judicial scrutiny and liable to be struck down on constitutional grounds. And that is the last message I want to give to my friends and colleagues to investigate, that these changes that have come in the legislation and the working environment, they need to be certainly examined. Please go to the last one. The history repeats itself. As I mentioned about the European case of pandemic, the Black Death, but you don't have to really repeat it. We can transcend it through foresight and planning. We should not be walking down this dangerous path. We must revisit the modification in the laws by December 2020, as has been said by the 7-judge Supreme Court, that these ordinances and laws need to be examined, and if they are against the constitutional provisions of the spirit of the Constitution, they can be struck down. I would like to stop here. Thank you very much.
Thank you so much, Professor Kundu, for your very enlightening remarks, which brought out many very important themes at the heart of this the whole debate. One of them being the unavailability of reliable statistics for this whole segment of the migrant population and the urban informal classes, and the need to give concerted attention to that in order for policies to be more strategic and effective in terms of the uplift of this segment of the population. The other theme, which I think was really the substance of what you shared, was this constant urge to amend or to suspend labor laws every time there is a desire to ensure that the economy grows and to give a stimulus to economic growth. And so there's always this tension between that policymakers try to negotiate between ensuring the rights of labor and their right to a dignified existence, and on the other hand, the model of growth, which suggests that a rising tide lifts all boats. So somehow let growth happen. And so I hope in the comments some of the other speakers will be able to address this dichotomy in the thinking on this issue. Our next speaker is Professor Partha Mukhopadhyay, who he is with the Center for Policy Research. He's been with them from 2006. He was previously part of the founding team at the Infrastructure Development Finance Company, focusing on private participation in infrastructure. In previous positions, he has been with the Export-Import Bank of India and with the World Bank in Washington. He has been on the faculty of the Indian Institute of Management, Ahmedabad, XLRI, Jamshedpur, and the School of Planning and Architecture in Delhi. He has published extensively, writes frequently for the national media, and also has been associated with a number of government committees. Professor Mukhopadhyay, should I put your presentation on?
Thank you for the generous introduction. Please put on the presentation. Exactly fine. It's fairly short, so I hope I'll be able to give you some time. Or would you just like me to share the screen? That's the other thing that I
Yeah, I'm just putting.
Sure, thank you. Control L should do it.
So, should I begin, Professor?
Sure. Can I? I'm just trying to see. Is it possible to get this? Get it on full screen, or?
Oh, sure. Yeah.
Yeah.
Just a moment. Yes.
Yeah. Thank you. Yes. So what I thought I'd do, given that extensive tour of horizon by Professor Kundu, is focus essentially on this aspect of return. And so the 3 slides of this presentation. The first one offers some hypotheses about why workers would choose to return to their, leave the city. Some of them will return to the village, to the city also, and we can talk about that. The second is a brief resume of the committee that Professor Kundu mentioned, which is the Interministerial Working Group on Migration, which I had the privilege of chairing a few years ago. The third is essentially a brief data snapshot of what is actually available, mixing the data from the COVID infections and the migration data that was pointed out by Professor Kundu. If you can just move to the next slide, Professor Fazli. Yes, please. So I think it's just gone back to the, anyway, as long as people are able to see it, it doesn't matter. So the first issue is one of the things that this return migration points out to is the question of whether people who essentially move to the city in India, do they actually want to live in the city? The usual understanding of classical economics in terms of rural-urban migration was that there used to be surplus labor in rural areas and there's a demand for labor in urban areas, and people used to move from rural to urban areas in order to work. But if you look at what is actually happening on the ground in India, there are a number of nuances to that particular core experience that makes it a much more complex phenomenon than a simple movement from rural to urban. I'll mention 2 of them. The first is the whole structure of the economy as such is not as quote unquote urban focused in terms of the large big cities as one would imagine. Even, for example, for non-farm activity, and in the case of something like manufacturing, more than half our manufacturing GDP and half our manufacturing workforce actually are in areas that are not classified as urban by the National Statistical System. So if you look at the National Account Statistics, they will tell you that half the manufacturing GDP actually comes from rural areas. Similarly, if you look at the National Sample Survey, they'll tell you that half the workforce which works in manufacturing works in rural areas. Now, obviously, there is a difference because there are certain kinds of smaller activities that might be happening in rural areas.
but this is also true in fairly major kinds of industrial sectors. Right? Some of it is the rural fringe of large cities, but others are much more about dispersed urbanization that sort of seems to be happening, which we and a couple of colleagues essentially have been calling subaltern urbanization, for the lack of a better phrase, for about the last 6-7 years or so. Now, so the first issue is the people who are moving to the urban areas essentially do have other kinds of options. The second issue is, in terms of that particular movement, they also recognize the value of being on a particular portion of the pecking order in the urban labor force. So if, for example, a taxi driver from Pratapgarh who drives in Mumbai may not want to actually settle in Mumbai because he feels that his children will actually not get the best opportunity if he moves his family to Mumbai, because the expenses will be high and the children will essentially have to go to a public school. And so given that the experience of housing in the slums of Mumbai, the experience of education in the public schools of Mumbai, he is much more likely to remit money back home to Pratapgarh, where his children get educated in relatively expensive. If you sort of ask these people about the kind of expenditure they make on their children's school fees, in small town India, these would be in the 2,000, 3,000 rupee range. Right? Because what he is trying to do is to essentially ensure that when his children come to the city, they're able to engage with the city at a different part of the labor ladder than where he or she is currently. Right? Because they don't want their children to be entering the city in the same hierarchy of the labor ladder as they are. In that context, the movement into the city, therefore, is still incomplete. It is not yet a complete movement, and it varies. For example, as was mentioned by Professor Kundu, if you are, and as you yourself mentioned, Professor Fazli, if you are from the disadvantaged caste, if you are a woman, particular religions, it's possible that the city might offer a space of freedom that is not available in the village. And that might be another reason for wanting to belong to the city. Right? So the first story is, if you look at it in terms of the return migration, you would see that in terms of single woman workers, that return migration may have been less, because single woman workers may be more interested in staying on to the city because it offers them a kind of space that the village does not provide. The second is in terms of the type of belonging. Therefore, it's useful to think of the return migration, as I said, in terms of the 5 reasons that I've put forward. The first is, of course, the lack of income. You have a large economy that was subsisting on a variety of activities, all of which came down during the lockdown. So you had a complete collapse of economic earning opportunities. There were efforts, and I think fairly substantial efforts. Mumbai and Delhi, for example, at their peak were feeding over 1 million people a day. So it isn't as if that local governments actually completely gave up on their people, but fundamentally, these are not people who are used to standing in queue to be getting fed. And therefore, they would prefer, for a variety of reasons, to go back home. There was also this second part of the story. There was a strong fear of infection, especially as the times have gone by. Cities are seen as much more dangerous places with respect to the virus as compared to the village. Third, to whatever extent has been happening around the government, and especially for women, it's where you see much higher labor force participation by women in NREGS work sites over the past few years. There was no work in the city, but oddly enough, because of this variety of government programs, there was possibility of work in the village. Lower wages, because the kind of wages you make on the NREGS is much less than what you would make in the city, but it's a possibility definitely in that particular structure. But what I'd also like to highlight was two other issues, which essentially focus on the issue of belonging, which is you want to go back, because you want to take care of people back home. As the person who has come to the city to provide for the family, you have a sense of responsibility for what is happening to them. This is not a lockdown just in the city. This is also a disruption of life in the village. And you have elders in the village. There is the constant information that elders are at risk. You want to go back home to ensure that they are safe. And you also want to go back home to ensure that if something happens to you, there are people to take care of you. That faith you do not have yet in the city, because you don't yet have that sense of community that will take care of you in the city. And it's at these two levels that you realize that these people still don't belong to the city, even if they have spent their entire working lives in the city, 15 years, 20 years. But if you're talking about are the people you care for in the city with you? Are there people who will care for you in the city? The answers to those questions may turn out in the negative. Right? That's the first issue in terms of belonging. If you can just move to the next slide, Professor Fazli, so when we looked at this issue in the working group report in 2015, in order to break this duality, the thrust of the entire report was essentially to ensure that the migrant worker was treated in the same way as any other worker. That was the core thrust of that issue, and the migrant was treated in every other way as the same as the non-migrant. So there were equality and legal protections, which are already guaranteed by the Constitution, but oftentimes tested every time. And you hear this constantly even now, states saying we shall reserve jobs for our residents, domicile restrictions which say that you have to be living in a particular city for a certain number of years to be able to even drive a taxi, for instance, language, which may be a reasonable kind of test in many respects. The second is based on our work under the Building and Construction Workers Act, which was the first sort of support provided by the government. We found that registration under the Building and Construction Workers Act, which is a pretty strong and a very relatively rich and well-funded fund, because it had over 35,000 crores in it. These registrations varied substantially across my colleagues Manish, Mukta Nayak, and Shamindra Roy in this paper essentially demonstrated that the variation across states was extremely substantial. So the second thing was enhancing awareness about the kind of social protection that already was there. Third is the question of mobility, which you currently hear as part of one nation, one card, ration card kind of initiatives that is going on. The fourth, again, is issues around effective housing. The cabinet has just announced something on rental housing for repurposing older housings. But also, it's important to realize that informal settlements provide a strong place of arrival for these kinds of migrants, and the improvement of informal settlements. And you see that in the variations across our large cities and our smaller cities across the country in terms of the ones which got affected by the virus, because of the quality of the informal settlements in those areas. And finally, as Professor Kundu mentioned, the release of data that would allow us to do these kinds of structures. So these were recommendations that were made about 5 years ago, which now are beginning to be sort of acted upon given the visibility of the crisis that has come into being. If you can go to the last slide on this one, please. So just to illustrate the kind of structure that actually happens, this is a slide, essentially work that was done by my colleagues Kanu Pradhan and Shamindra Roy, where they looked at the 2001 census and worked out corridors of migration. Right? So moving from Ganjam to Surat was one such corridor where a lot of migrants had moved. The x-axis shows you the share of the migrant in a particular city. So 11% of the migrants in Surat came from Ganjam. And the y-axis shows you the distance of that place from the origin to the destination. And they took 15 high infection districts where the virus was, which is essentially our large cities, and mapped out the migration corridors to these places, looking at how the structure was bound together. And if you see the bottom left-hand corner, those are essentially the peripheries of the cities. Lots of places, relatively small share in each of them. But so it is people coming from the nearby. In this case, of course, nearby was sort of seen as 1,000 kilometers, but you'd see low shares, but roughly around that same structure going forward. And a lot of these people are the ones that you saw walking home, right? Because you're looking at 500 kilometers, not something that you think of walking, but under the kind of circumstances that they found themselves, you found them walking home. And half of the sort of migration into these areas comes from this sort of broad neighborhood. But the focus has obviously been on the Ganjam-Surat kind of migration. And in fact, what you have now seen, and fortunately, I think Odisha was prepared for it, a lot of the people who moved back from Ganjam to Surat did result in a number of infections in Ganjam district. What that points out too is the fact that given the nature of this virus with lots of asymptomatic infections, you have a situation where a lot of these, and we have seen that in the case, for example, of Nanded, where about 4,000 pilgrims who were in Nanded went back to Punjab, and about over 1/3 of them were actually infected with the virus, that these migrants in many places were stuck in small, dense settlements where a number of them were infected, they recovered, they infected other people. Fortunately, because the virus itself, only a small proportion actually get sick enough to require serious medical attention. And the probability of that happening is even lower when you are young, which many of these migrants are. You end up with a situation that the virus circulated within these dense communities, but did not necessarily lead to the large-scale kind of deaths or disease that would have brought those communities into visibility. If you suddenly see a lot of people falling seriously sick in these communities, would have been a different order of problem than what we had today. But as a result of which, what you have is, to some extent, this kind of thing has now gone back to the villages, and there, depending on how the state governments have been prepared for this, and you are seeing the shift in the kinds of infections that are happening in, there would be differences, because there in the villages, you have older people who are more likely to be affected, and you also have lesser access to kind of medical care. So that is the risk that we need to worry about. But fundamentally, what you essentially have is a situation where these kinds of linkages were possible even with the rudimentary data that we had to discover. And the recommendation that a number of us and Professor Kundu made for providing them transport early on, rather than the kind of movement that you saw later, and the sudden rush that again happened later with cramped train structures, etc., could have been done much more systematically, much more humanely over the entire lockdown period, had the government merely chosen to provide these kinds of facilities to these people. If you can just enter the final slide, Professor Fazli. So the core issue that I would like to point out is all of this, and the reason why I think registration is a complicated story is because for a migrant, it is not entirely sure whether the government is an entity that you want to trust. And given that structure, what you're worried about is whether, as a result of that particular registration, are you making yourself more vulnerable to actions by the government? And as long as this quote unquote fear or lack of trust in the government remains, what we will have is a citizenship that is going to be impaired, because people will be afraid to demand their rights because they expect that they might actually be acted upon in return. And it is in removing this kind of apprehension that both civil society and the political class now need to start working. Thank you.
Thank you so much, Professor Mukhopadhyay, for your very wonderful presentation, which gave us a much more granular picture of the crisis that we've been seeing over the past couple of months. And also, as you mentioned towards the conclusion, it brought out for us the role for a kind of governance that is responsive to the realities of these people, which is often not, is messy, as it's not a tidy kind of reality that fits within classificatory schemes. So because we are running short of time, I will quickly introduce our next speaker. Dr. Siddharth Agarwal is a trained physician. He has worked in the field of research and programming in the area of public health, social welfare, and normative support for national and regional governments since 35 years. He is the director of the Urban Health Resource Center in New Delhi, a non-profit organization that works to improve health, nutrition, and well-being of the deprived, underprivileged urban populations, and which played a key role in Government of India's National Urban Health Mission, which mandates reaching out to all listed and unlisted slums, vulnerable settlements in India. He has been a member of several Government of India committees, member of several international committees and panels, and an advisor to the World Health Organization, UN Habitat, UNFPA, and UNICEF. Dr. Agarwal, please. go ahead. You have to unmute yourself.
Yes.
Dr. Agarwal, can you, your video has frozen. Can you hear me?
It is a pleasure to share practical experiences, many of which are also from Indore. So these are images of the people we are talking about. So with Professor Kundu and Professor Partha having talked about data, this will have human faces. We see the laborers in different cities in these images. Here are some more images. 3 of them are from Indore. The upper right hand image is from Kolkata. You see a rehabilitation image, sense of resignation, and people wading through a drain. These are brick kiln workers and construction site workers. All the images are from Indore. They provide low-cost labor. There has been policy progress, which Professor Arash mentioned, that since 2003-2004, there have been several policies which have been brought out by the government. And 2013 marked the Gazette notification of the National Urban Health Mission. But unfortunately, there has been little action on the ground. So now there will be 10 lessons that we have learned, practical lessons that we have learned from Indore and Agra, and these are the 2 examples also mentioned in the National Urban Health Mission. The first is women's groups in slums, which the policy calls 𝗏𝗏 Samitis, and these are mandated in the National Urban Health Mission, and they can be trained and mentored by an NGO or by the Urban Primary Health Center. You see these women's groups sitting and chatting in this slide. The second strategy is regular outreach health services by government and private providers in slums and similarly deprived clusters. You see these 4 images of those outreach services being provided in the slums of Indore and Agra. These pictures belong to Indore and Agra. This image shows nutrition and health awareness cum behavior promotion session by the women's group of the slums, which again, as I mentioned, is called the 𝗏𝗏 Samiti in the policy. There is a provision in the policy for what is called the Community Revolving Fund for Health Exigencies. And so this helps build skills self-reliance and self-efficacy among the vulnerable urban poor communities. And you see images of women sitting and collecting the contributions. There is this money box, there is a register and a passbook. This our center manages in Agra and Indore, across about 400,000 population. And in addition to health, we have realized that they have other needs like children's education, toilet construction, starting a small business or expanding it, purchasing food grains, and repaying money lender debt. So they also use it for that purpose. The fourth strategy is the urban ASHA, or the accredited social health activist, who plays several roles. And in this picture, you see her accompanying a pregnant woman to the hospital. And trained members of women's groups in slums are emerging as urban ashas in both Indore and Agra, where Urban Health Resource Center, or UHRC, has been providing this training. The fifth lesson that we have learned is empowered women enhance their capacity to take care of the family. They also reduce alcohol vending and gambling joints, which is an indirect determinant of health. They promote savings, they promote girl-child education, and they help repay money lender debt. They also prevent early marriages among girls in a society where families consider girls unsafe and marry them early. There's another, the next strategy, the sixth, is about the use of maps. And this is the map of Meerut. Meerut is a city which used to be about 1.5 hours from Delhi, but these days it is 3.5 hours from Delhi. And the red dots are the unlisted slums and the blue are the listed slums. So just the map with all the slums plotted helps in inclusion of those who get left out in the plan of the city for any type of work. This is a neighborhood map, hand-drawn map. This is from Agra, of a slum, and you see the lanes and the houses. And this helps list those houses which require the sewerage system, toilet, or any other entitlement, and likewise helps identify health services, and also helps identify recent migrants who usually live in rented rooms, because the recent migrants are the weakest and they get left out. This is a map of Indore, and here just we have pointed out construction sites and brick kilns of Indore. These are the urban poor who are usually not counted anywhere because they're generally seasonal migrants. But there are very large number in Indore or in any city which is growing very fast. So just having them located on the map can improve their likelihood of being included. The seventh lesson that we have learned is that slum dwellers or the urban poor are very smart, and they can assess the condition of their neighborhoods themselves using simple qualitative indicators, where a red dot indicates the slum having a bad condition. For example, if that slum, in that slum, most houses do not have toilets, so they would denote the toilet condition with red. Or if there's another slum which has improved, they would denote it as yellow. And if there's a slum which has improved substantially, they would denote it as green. So this helps the community itself determine the need with greater clarity and also take action. Because, for example, if they have unpaved lanes, the action is to make a request to the municipal corporation. The next, which is the 8th lesson, is actually the demand side negotiation of policy implementation. So in our country, usually these larger policies of urban improvement have been made by many committees and are broadly they have a framework which is not lacking to an extent that nothing can be done. But despite the budget flowing to the city, very little is actually done. So therefore, a demand side push is required so that there is pressure on the civic authorities to respond to that push. So here you see a letter, handwritten letter by the community. And on the right, you see a receipt from the district magistrate's office. In the district magistrate's office, they issue a formal computerized printed receipt. In the center, you have a picture of women giving that letter to the elected politician, who's the ward councillor. And the other picture is showing women registering the community request at the district Jan Sunwai. So in India, we do have reasonably good systems. It's important to use those systems and not just dismiss them. And then the thing written in typed in white at the bottom talks about perseverance, maintaining a paper trail, politeness and tact, and also a polite thank you with tea and biscuits when the municipal executive comes to the basti. Because this is something you have to keep doing for a long time. So it's not that you've done it and it's done. The 9th lesson is that children and youth groups are emerging as the force of the next generation. They wrote letters, and that was actually also covered in Patrika in Indore. And they also performed Nukkad Natak, and Professor Arash will recognize that this is Rajwada in the image where the children are performing the Nukkad Natak. The next lesson is that if these informal settlement dwellers, particularly recent migrants, they don't have any type of idea of the city, then they're not considered legitimate. A point which was also mentioned by Professor Kundu and also Professor Partha. So this bringing them legitimacy is important. So what we've realized is that they have to understand how this is done. You have to navigate through the maze to get a picture ID, a government ID and proof of address of Indore to reduce the challenges that you face in the city. I mean, because even in the government medical college or the district hospital, a person can refuse you if you are unable to show an ID with an address of Indore. They should not refuse, but you know they would just want to reduce their workload, so they tend to refuse. Therefore, we've helped them understand. For example, there are kiosks in Agra and Indore where there are youngsters who facilitate this process online. And these women understand how this has to be made, and youngsters also understand. The other message I wanted to convey is that bringing stakeholders together at whatever forum is possible also improves the likelihood of services reaching to where they are supposed to reach. And this shows a meeting of the municipal corporation, slum women's groups, NGOs, health department, Department of Women and Child Development. Here I wanted to summarize, if this can be visible, why any improvement of implementation of any urban development policy, or for that matter, even in rural areas, the responsiveness of any authority needs strong demand from the society. So on this side, you see the demand, and on your right, all the columns are showing the demand. The demand is through those written letters from the community with 15 to 20 signatures. The negotiation skills building among the community, the groups forming in the community, those groups becoming powerful and being able to negotiate with politicians, not being scared of politicians. Even during COVID, they were able to negotiate ration, free ration for disadvantaged families. So you have to negotiate because you know that that is how our system works in at least South Asia, more or less. And that improves the responsiveness of how this government functions. Now, here are some glimpses of improvement, just images. This is from Indore. The center is the unpaved street. The right-hand side, the street is getting paved, and the sewerage system is also getting laid. And on the picture on the left is the same street after the system was laid. Here you see garbage next to the drain on a slum lane, and on the right you see a cleaned slum lane. Here you see children and women crowding on a single tap, and then when the negotiation is done, a large water tank is erected and there is not so much need to queue up. You see the illegal electric connections, and then you see the metered electric connections. Now, this is something which could be surprising to many, but we've succeeded in getting the slum dwellers grow vegetables despite all the adversity that they live in. So they have been able to grow vegetables. During September 2018 to 2019, about 500 families grew 8,500 kg of vegetables, and they saved approximately 33 lakh rupees, which they would have otherwise spent in some way or the other based on the cost of those vegetables that they have to purchase. Here you see children applying for scholarship and getting their documents approved at the elected ward councillor's office. And I would like to end by saying that we should try to make the invisible visible and lend voice to the weaker citizens. I have purposely included the hyphen in the word citizen, and we should translate words because all policies or action plans are just words. Whatever I'm saying are only words. They have to be translated into real action towards inclusive urbanization. And I wish to end with hope and confidence that the government stakeholders, private actors, NGOs, academia, and slum communities will act what Gandhiji said many years ago, that a small body of determined spirits fired by an unquenchable faith in their mission can alter the course of history. Thank you.
Thank you so much, Dr. Siddharth Agarwal, for this, giving us some practical insights into the issues and also strategies that actually have worked in terms of empowering people, especially in the slum areas that you work with. And now, we have time for questions, but I think maybe in the interest of time, we will take the questions at the end so that we have an opportunity to listen to our three other speakers as well. So your questions, just want to share with the attendees that we are keeping your questions and they are very valuable. Please continue to share them. And we'll try to give enough time to discussing those. Our next speaker today is Dr. Pooja Guha, who is a trained economist specializing in development economics, labor and migration. She has a PhD in economics, has been involved with various national and international research projects on labor migration, informal labor, and labor policy. She has also trained a number of economics and statistical officers of the Indian government on econometrics as part of the short-term in-service capacity building program for service officers. Currently, she is a faculty member with the School of Development at Azim Premji University, Bangalore. Dr. Kuha, please.
Yes, thank you, Dr. Fazli, for first of all giving me an opportunity to come and speak here. And secondly, it's a very pressing issue and topic that we are talking about today. And I'm really happy to come and talk here because my current research, my current work is very much around this issue. So what I would be doing in my talk is kind of building up on what the earlier speakers, Professor Kundu, Professor 𝗏𝗂𝗵𝗏, what they have talked about in a macro way. What I would do is I would use some of my field narratives to see or to probably highlight what it means to the people on the ground. And very similar to what Dr. Siddharth just said, giving a face to these numbers. What I'll do rather is getting the narratives of these people, right? And say, for example, what the migrants are actually saying when we ask them whether they want to return or not. So I don't really have a presentation as such, but I just have one slide which I can maybe show, which has a little bit of data. But it's largely to do with the narratives and the discussions that we have been having with some of our respondents on field. So getting into the topic, what I would be talking about is the precarity of these urban informal workers that we have been talking about so far. Now, when we say urban, we have a lot of data, though not as much as we would want to, but then some data which tells us the kind of vulnerabilities, the precariousness that these workers are going through. What I would like to talk about or focus on are the self-enterprises or the self-employed informal workers with whom we have been working with for quite some time. And we realize that their precariousness is somewhat different from the other urban informal workers. It is not to say that the other informal workers are not precarious, but this is to highlight that the informal workers are not a homogeneous set of workers, and each one of them have their own set of precariousness. Now, when we say self-enterprises, what we have got from, I'll just quickly share my screen here if I can, yes. What some of the recent data suggests is that of these informal workers in the urban areas, due to the current pandemic, close to 80% of the workers have lost their job. And this is from a recent survey that was done in the Center of at the Azim Premji University. And also what the study highlights is that people who manage to retain their livelihoods, their incomes have dropped by more than half. So they are actually, doing very worse off and very in a very destitute kind of state. Now, out of the to focus on the self-employed enterprises. Now, why this self-employed enterprises? One very important reason, when you look at the number of people who are involved in these self-enterprises like street vending, it's close to 20% of the informal workers. And if you actually look at the numbers, then the Street Vending Act report suggests that there are close to 10 million urban individuals who are involved in street vending activities. And this is also a livelihood which is particularly attractive to women and children. Now, having said that, what I would like to present here is some of my narratives which we have found after talking to the street food vendors in the city of Bangalore. Now, why food vendor? It's a very interesting livelihood. Now, these food vendors are not the typical street vendors who are very much mobile. Rather, they are on the street, but stationed at a particular location. And the location matters to them because that's a space that they have created in the urban map. And also it allows them to have a certain set of regular customers, which is critical for their livelihood. Secondly, what is important for us to understand is that these street vendors are, street food vending is a livelihood which primarily runs on household labor. So the entire household is dependent on one livelihood, which is the food vending. There's no other livelihood diversification. The third and very important thing is that what we have found in our study is that most of these vendors are migrants. And the reason for this is because it is easier for the migrant to get into such a livelihood, and also through their own food, they're kind of creating a social inclusion, a social inlet for themselves into the larger cultural fabric of the city. So somebody coming from Odisha, settling in Bangalore, right, through a medium of food, because that's how he or she tries to get themselves included in the larger cultural fabric of the city. So this makes food vending a very interesting livelihood, and also it's a self-enterprise. Now, what happened? So what we have done is we've been having discussions, we've been having interviews with many of these street food vendors before the pandemic, and as well as even the current time. So what we have seen is that prior to this pandemic, the kind of interviews we used to have with the street food vendors, we found them to be quite stable in their livelihood, which meant that we never saw a kind of need for them to move to a different kind of livelihood. In fact, many of these street food vendors had transitioned from a formal livelihood to such informal livelihood of vending food on street. Now they had a stable livelihood, and they imagined it to be sustainable. Now, what happened during the pandemic, right? Now, the pandemic created a stir in everyone's life, particularly for the urban informal workers. But what happened to these street food vendors is very, very unique and typical. On the 22nd of March, when the first lockdown was announced, that is when something very critical was snatched away from these street food vendors, and that is the street, their only place of work. So once the street was snatched away, they lost their workspace. Secondly, with everything closing down, people staying at home, they lost their customer base. So with no place to work, with no customers to cater to, there was a complete loss of livelihood for these street food vendors. And it was an immediate loss of livelihood. Now, the interesting part about these street food vendors, and this is also drawing from what Professor Mukhopadhyay just said, that not all these street food vendors were poor, or they were categorized as poor or had any poverty-related cards, because they had an established business. But the closure, or a sudden closure of their livelihood and a complete loss of income actually pushed them to the brink of survival, right? So what happened was, whatever mere saving that they had, it was utilized in gathering some food, for basic food for survival. But the debts, the rents, the school fees were mounting, and they had no source of funding for these kinds of expenses. Another thing that happened, which was again what we found very interesting, was that when we asked them what about the relief food packets, because we know for sure in Bangalore at least there are several groups that are involved in providing for such relief food packets. Now what they said is that they were not used to standing in the queues and asking for food. They were the ones who were providing for food. So it was below their dignity to actually go and ask for food in such conditions. So they preferred to stay at home and and use whatever existing food or whatever existing resources they had in their homes. So this was kind of a strange situation for them, where they were trying to cope with the pandemic with all their might, but with no possibility of livelihood and no alternative livelihood to fall back on. Things were getting critical and extremely precarious for them. Now, what were the coping strategies? So when we were trying to understand how they are coping, so we have been doing interviews. Even now we are doing some interviews just to find out how they are doing. We found a very interesting trend there, and we can divide them as migrants and non-migrants. So when we looked at the non-migrants or the residents, the so-called citizens of that state, we saw that they were trying to cope up again using their whatever meager savings that they had, but they also had a kind of social network, which is what they were trying to fall back on. Some of them moved back to their villages, but these villages were not far away, so it was probably in the same state, and they're just waiting for the situation to improve so that they can come back to the city. Now, what was happening in the migrants was far more interesting. And this is where we see that we kind of question that, are these migrants homogeneous? Can we call all of them as migrants? And I'll tell you the reason. Now, when we spoke to some of the street food vendors who were migrants and who had migrated, say, 2 or 5 years ago, for them, it was much easier to go back home because they had a social network back home to fall back on. So immediately when the lockdown was announced, they managed to go back home, or whenever the trains opened, they wanted to go back home. And when we ask them about their return plans, they are not very sure when they'll come back, because at home they've found some kind of both social network in terms of livelihood, also in terms of the other basic needs. For example, having a shelter, having basic food. So it is, for them, it is still kind of unsure when and whether they will come back. They would definitely want to come back though, but they are not sure when they would want to come back. The case was, however, very different for the migrants who had migrated to the city for the last 15, 20 years. So there have been people who had come from Odisha, from West Bengal, and who've been living in this city for the last 20, 25 years. And there we saw this kind of constant contention whether to go back or not. So some of the migrants whom we talked to, they have gone back, while others decided to stay back. Now, people who went back, when we had a discussion with them, they said that, and that's a very important thing, what they said, that we came back here, but this is not our home. Our home is in Bangalore. So we have built a home there. So the identity of these people with the city as their home was something which we are trying to understand and see why they are calling it home. So when you look at it, you realize that they've had their families here, their children are going to a school here. So it is difficult for them to uproot themselves from the city and go back there and stay there, live there permanently. So in fact, most of these such migrants, they are just waiting for things to settle down, and many of them have actually are coming back. But one important point here is that they know that their livelihood is probably still at stake in the city. So they are aware that the streets are still not open, and maybe if they try to open the car, they will not be having enough business. But still they would like to go back because this is their home, the city is their home. And there were other migrants who did not even go back home because they have lost the entire social network back home. So this brings in this debate of the outsider versus insider. So we consider migrants to be outsiders, and we kind of tend to homogenize them, that all the migrants, they come from outside. While in a definitional way, we talk about migration as, in the policies, we talk about it as, or we measure them as place of usual residence or place of birth. But in such kind of cases, it's more of where the person is identifying himself or herself to be, and that's the city. And that is a critical thing that we need to think about when we are talking about migrants, or when we are talking about people, whether they will come back or not. Now, how do we actually address the policy in this sense? We were trying to do some kind of analysis with the current relief programs that have been announced for the urban poor, specifically for the street vendors. And there is this policy under the 𝗏𝗏𝗏 Yojana, there is something called 𝗏𝗏𝗏 Yojana, which entitles the street vendors, particularly street vendors, to avail a loan of ₹10,000. And then there's also this whole gamut of MSME policies. Technically, these self-enterprises fall in the MSME definition. However, what we realized is that very few probably not even 1 or 2%, will actually be able to avail this scheme whenever it is up there. The reason being, these schemes, they require certain kinds of registration. By registration, I mean you need a license for street vending, and that can come only through something called a Street Vending Act, which has been proposed in 2014 and which is yet to be implemented in most part of the country. Bangalore still doesn't have it. So until unless you have a license, until unless you are registered as a street food vendor or a street vendor, you cannot avail any of these policies. So just imagine the kind of uncertainty that these the street vendors are, particularly the street food vendors, are undergoing. In case of non-migrants, they would probably look out for other alternatives or have a kind of social network to fall back on. But for the migrants, and especially the ones who had migrated a long time back, their social network is very thin. And whenever the streets open up, it has started opening up, they have an added challenge. And that challenge is reclaiming back their space, because it's a public space. And given that they have no registration or a license, they can't claim the space. It took them 25 years to claim a space, and it may take a while to get back to their space. Negotiating with the authorities, so they probably have to start afresh, doing the kind of negotiation that they did to create a space for themselves in the urban setup. And the third and the very important thing, which is affecting the street food vendors particularly, is the stigma associated with COVID. So when there is a lack of trust on outside food, when there is a lack of trust and we are practicing social distance, the vendors are very unsure whether, even if the streets open, whether they are going to get back their customers or not. So this kind of highlights the precarity of not just a migrant, but the entire livelihood in this larger informal sector. And also particularly the migrants who are kind of, they've lost both the social network at home and have a very thin social network in the urban space. So in spite of identifying themselves with the city as being their home, probably the city is yet to include them as residents. Yeah, so I would like to stop there and would be happy to take some questions later.
Thank you so much, Dr. Guha. This was a very interesting presentation, which focused on a particular segment of the informal sector, which is the street food vendors. I think for me personally, it triggered a lot of reflection. One of them being, you referred to the value that these members of the informal sector, both migrants and the reliance on social networks, and how that plays an important role in their resilience and their ability to deal with adversity. And also Professor Mukhopadhyay had earlier mentioned about the challenges, which also you mentioned, and Dr. Siddharth Agarwal also highlighted, which is this challenge of these disadvantaged groups being able to access the facilities of the state, being able to access various legal provisions that are in name made available to them, but somehow they fall between the cracks when it comes to actually availing of them. But then it also provoked a reflection on how these people are viewed. In other words, like I was thinking of this when Dr. Agarwal was speaking, that one way to view them is to say, here are people who need to fit within the urban economy. And in order to fit within it, they need to be equipped with these skills, and they need to be legally empowered. But another way to look at it, which some of your comments brought out, was to also see what they bring. Their sense of dignity, their social networks, their sense of solidarity with each other, which I think Dr. Agarwal's presentation kind of touched on, which different civil society organizations are learning to tap into in order to mobilize these segments. So perhaps at some point when we have a chance for a discussion at the end, we can also think more about their sense of agency. In other words, is this a segment that is just acted on, or are they actual contributors to civic life? Maybe the path to them making their contribution is obstructed, but do we see the potential? Are we even recognizing their maybe they don't have access to civic amenities, but what about their culture? What about their convictions? What about the relationships that they have, which enables them to survive? Their creativity, their ingenuity in Indore they say their ability to do jugaad, which is with very little they're able to make a fruitful, productive lives for themselves. So our next speaker is Dr. Bandana Swami, a faculty member in the School of Development at Azim Premji University, Bangalore, where she teaches core and elective courses on development theory, state and Indian politics, land and development, and the sociology of food. Her research interests are in historical and contemporary development issues. Currently, she's working on research projects on labor migration in India. Dr. Swami.
Okay. Hello?
Yes, we can hear you.
Okay, wonderful. So thank you very much indeed to Dr. Fazli and to the Bahá'í Chair for organizing this very, very important discussion on inclusion, on urbanization, and the working poor. I mean, if it takes a pandemic to have outcomes like this, one is left in a very, I mean, it's an odd situation. 3 months ago, we perhaps would not be feel the compelling need to have discussions like this. And here we are, 3 or 4 months down the road, and suddenly these issues have erupted with a volatile force on our social, political, emotional, mental, financial landscapes in an unprecedented fashion. So I believe, this is also one of the outcomes of a pandemic like this, right? In the interest of time, because we are running pretty late, I think I'm going to cut short quite a bit of what I had to say. And also I'm in a difficult situation because I've been preceded by such wonderful speakers who have actually, brought out so many of the macro nuances, so many of the economic and policy aspects, questions of belongingness, questions of, what the city means. And Dr. Siddharth Agarwal particularly, one of the things that I feel very strongly about is that the vocabulary of the discourse of inclusion, I find to be very inadequate. I find it to be very sketchy. We talk about inclusion, but then we don't really actually want to parse out what is the meaning of inclusion in a class divided society, right? What does it really mean when we are talking about inclusion, when at the same time we are committed to hierarchy, we are committed to class divisions, and we are committed to maintaining them. So in that context, to me, the discourse of inclusion, it's an interesting concept. It's perhaps a useful concept that we have and a very important one, but it doesn't seem to offer too many tools as to what really to do with it. So in that sense, I found Professor Agarwal, Dr. Agarwal's presentation to be very enriching, because I think you showed that when people come together with a mission to transform, and they are persistent about it, there is no lack of ways forward, And I think I find a great amount of solace in seeing the work that you have done, and I think that's very, very important, right? So with that, again, my conundrum of what can I add to a discussion that has already been so rich, I think what I'll try to do is perhaps just add some critical reflections, right? And try to add some sociological perspectives to all of these, rich cross-disciplinary insights that we have been listening to for the last sort of hour or so. So, when I was invited for this panel, I was trying to weave these three terms together. The first being city, right? The term city, the second being urbanization, and the third being inclusion, right? And to me, what stood out among all these three terms was that none of these three categories and processes is a new phenomenon, right? Cities are as old as humankind. Cities are absolutely not new forms of human association on this planet, right? We have had Middle East as the cradle of civilization, if you will, and there have been cities going back as far as 3200 BC. So city is not a new form, for us, right? Similarly, and of course, you can find cities, very, very ancient cities in all parts of the world. And I think that's something to understand at this point. The other thing is also urbanization. So urbanization is also not a new phenomena at all, right? In a lot of these ancient cities that I just referred to in passing, you will find, I mean, if you read some historical works, you will find dramatically interesting forms of urbanization in these cities. So urbanization as a process is also not new for us, right? And the third being this very, very interesting conjunction of these two things with the question of inclusion, right? So here, I think I'm going to make a hazardous generalization. And I'm going to say that in cities, historically speaking, inclusion has always been a challenge. Okay, I don't think you will find, even in Greek city-states that are always held up as crucibles of democracy and such. You will find these cities struggling with questions of inclusion, struggling with questions of hierarchy, and slave labor, gang labor, chain labor, caste bondage, and these forms of social struggles have always marked urban life and life in city through the ages. So, for us to talk about this in the 21st century, it's very important to recall that we are talking about long processes, long genealogies, and there's a lot to learn from how these things have played out in the past, all right? So, of course, it's not the same. Obviously, there's been dynamic transitions over the historical eras, and I will say only a little bit about what these processes and the way they have come together in the modern era, right? Because that is our contextual universe here today, and this era that we call modernity, right? So a word that has not appeared in this discussion so far is capitalist industrialization, right? And I think it's very, very important to bear in mind that modernity, right, was very much and very closely tied to capitalist-led industrialization, in which scientific and technological advancement played the flagship role, right? So, and that is also a process that we are seeing as a continuum across ages. And modernity itself being 400, depending on where you think modernity starts, it is a process that is about 4 centuries or 5 centuries old by now, right? And the reason why I mention this is because a lot of the urban thinking that we bank ourselves on, a lot of the urban theory that we utilize in all of our work actually comes out of this very long 18th century transformation. You know, the Industrial Revolution is perhaps, I think Professor Kundu also brought that aspect here. A lot of our urban theory derives from that experience, right? And here we are in the 21st century, still trying to talk about cities, right? Whereas actual realities have transcended, you know, the city and its understanding in such a fundamental way that the city is spilling over into the rural, into the peri-urban, and the rural is spilling over into the city and into, you know, so this very heterogeneous landscape that we have, you know, we find ourselves in, I want to say that it is not very well understood, right? I want to say that we have, if not outdated models, we have models that need to be synced with new realities. And you know, and there are some leads on that one can look at, and I think those are very useful, right? You know, talking again about the question of inclusion and the ironies that surround it. One of my, you know, again, one thing that perhaps has not come into this discussion so far is the question of political will. You know, I don't think we lack, you know, we lack talent in terms of intellectuals, we lack talent in terms of academics, urban planners, you know, people like Dr. Agarwal, Pooja's work, my colleague, and I have not heard Caroline, I'm sorry, I'm, you know, looking forward to your presentation. We don't lack creative ideas. I think what we lack, you know, what we lack squarely is political will. Because again, you know, referencing the pandemic, although to me this is a much larger question, you know, the pandemic has brought it to the surface. But if migrant workers, and I'm really sorry to say this, if there were no deaths of migrant workers and children on the streets, the political will that we now see, you know, come up to the surface very incrementally, and after 2 months and 3 months, and all the hardship that migrants go through, we would not be talking about. So to me, the question is very important. The question of political will. If there is no political will, then I'm afraid we are still going to be stuck into deeper and deeper and deeper urban crises, and we are going to build more and more dangerous cities and more dangerous urban hinterlands, and the rural is going to be devastated to a degree that we cannot imagine. So I think we have to be very wary of these dangers that are lurking all around us and recognize them. And it is, to me, it is only through concerted political will that you can keep this discussion alive. So that's another thing I want to add to this discussion, is the necessity and the absolute necessity of keeping a sustained political will. Now, of course, the obvious question is, what do you do with your political will, you know, in a situation that looks more and more undemocratic, you know? Even if you take something like, you know, Partha Chatterjee's very, very interesting distinctions between political society and civil society, and how to empower political society, which I heard a lot of the panelists talk about. How do you do that today? You know, how do you make struggles for rights happen? How do you make struggles for you know, basic amenities happen? So I think, to me, these are equally important challenges. Challenges of conceptualization, challenges of understanding, because you know, somebody has to explain how we can have a Tesla, you know, a driverless car, and we are simply unable to provide drinking water through a pipe in a slum. You know, you know, the simple answer is that there is no profit in bringing water to a slum, and there is perhaps, you know, a lot of interesting profits to be made in Teslas. So again, it is only, I mean, who's going to take up the task of bringing clean drinking water to slums? Okay, has to be thought about. And this is where I think, again, I want to bring in another term, which I heard, but I think the discourse of inclusion and urbanization very fundamentally has to bring in the aspect of citizenship. You know, the migrant worker and the working poor and the disempowered and the marginalized absolutely need to be seen as citizens. And without that, a lot of this discussion is going to lose real value. You know, it is very important to have basic amenities of life, but they cannot be seen as disempowered and disenfranchised individuals. So to me, this is, this is very important to stress on looking at the marginalized as a valuable member, a contributing member of society who bring in, enormous amount of contribution to the GDP, and some of our speakers mentioned that. So that is the citizenship aspect. The other thing, and again, this has been said in different ways, I think we have to highlight how predatory our models of urbanization have been, because given just the invisibility of the working populations and the migrant poor and the people who live in slums, unless the pandemic came to the surface to rupture everything and bring it out in the open, we would not be looking at all, right? We would not be in a position to realize our vulnerabilities and our dependence on these people. So to acknowledge their contribution in making cities, in making urbanization possible, both in a short and a long-term frame, is very important, right? So how will we accomplish this task of redressal, right? How are we going to accomplish this kind of justice that is required? I want to be a little idealistic, right? And say that maybe I don't want to see a slum. What would dignified housing look like, right? What would dignified housing look like for these working poor? So again, in the interest of time, I'm just going to stop now. I do have a lot to say, but maybe it'll come in the discussion. Struggles have to be aligned, right? And I think that is very, very vital if we are trying to think about inclusive cities, right? So the struggle for decent living wage, the work of a trade unionist in that respect, in trying to get safety, in trying to get healthcare, and trying to get benefits, very much has to be in alignment with the struggles of sanitation workers, right? So if this alignment can happen, and be given power and be given voice, I think we will create a robust platform that is going to have a concerted voice and a concerted presence. It's going to give this whole discourse of inclusion life and vitality. And I think that is in need of the hour. And I'll stop here because of time, but maybe in the discussion we can talk more.
Thank you so much, Dr. Swami, for bringing into the discussion the bigger questions which have to do with modernity itself, capitalism, and the logic of exploitation, which is somehow inherent to these models that we have acquired as in the process of modernization. And also discussing the various crucial questions such as the need for political will and alignment between different efforts. I'll introduce our last speaker for this webinar, and after that, hopefully, if you will be a little more generous with your time, we will take some questions. Caroline Custer Fazli holds a master's degree in participation, power, and social change from the Institute of Development Studies, University of Sussex. She has worked in a number of different development organizations in India and internationally, including the Bahá'í International Development Organization. She is currently pursuing a professional doctorate in policy research and practice from the University of Bath, focusing on the role of grassroots participation in generating knowledge for development and its relationship to policy.
Thank you. I'll just share my So first of all, thank you to all of the other speakers. It was very, fascinating to hear your thoughts. And in my recent work on this issue of urban policy, I have definitely been drawing on some of your work and some papers from the institutions that you're working with. So it's nice to hear all of you live. And this presentation is not directly about migration, but it does definitely concern populations, among whom are many migrants in informal settlements in Indore. And the title of the presentation is "Whose Knowledge Makes the City Smart? Exploring Conceptions of the Role of Knowledge in Urban Policy in Indore." And from my accent, you might make out that I'm not born and raised here, but I am settled in Indore now, and I've been living here for the last 6 years. I very much consider myself an Indori, so it's in that spirit of, as a concerned citizen, that I think about these issues of the direction that urbanization is taking at present. And I was involved in a research project in 2018 in a couple of informal settlements next to the river in Indore called Kabutarkhana and 𝗏𝗏. So I'll be talking about some of the findings from qualitative research that we carried out there. And I wanted to, in this presentation, talk about, again, this concept of how we can envision a more equitable and inclusive form of urbanization. And as the flyer for this webinar said, to make cities belong to those who build them. So what I'm looking at here is the Smart Cities mission, which commenced in 2015. And Indore was one of the first cities that submitted a proposal which was approved to get funding under this mission. And I wanted to, when we talk about smart cities, immediately the idea of smart suggests certain ideas about intelligence, about knowledge, and then it raises maybe certain questions in our mind about what do we mean by smart? Whose knowledge does this involve? What forms of knowledge does this involve? Who generates that knowledge? So I wanted to look at a few of those questions. So, and of course, this idea of the smart city is not confined to India. It's picking up on like a global course about what it means to have a smart city and about smart urbanism, which maybe before we just adopt it wholesale, maybe it would be worthwhile examining some of the assumptions which are embedded in it. And this is very much in the tradition of, when we have this historical institutionalist approach to policy analysis, there's a whole theoretical body of theory on the role of ideas in policy. And this field here on the top right about policy paradigms, I wanted to look more at that area rather than focusing on the policy actors and all the power struggles between them, which can seem very intractable sometimes. I wanted to look at maybe some of the background assumptions which can be embedded in policy ideas, and these basic paradigm, which is framing all of our policy proposals and programs, it contains certain ideas and standards which are taken for granted and therefore unamenable to scrutiny. So if you don't look at a deeper level, what are some of the, so for instance, I think in the next slide, what are some of the basic concepts that we're assuming about who the human being is, who the individual is, how the individual relates to the community and to the institutions, even things like who are the poor, and how we see them, their capacity, what is development, how does social change happen? There's assumptions about all of these which are embedded in the whole worldview, which gives rise to different policy proposals. And I think if we look at some of those, it can help us then to reframe in a way that can enable us to move forward and to reach new ideas rather than getting in a deadlock. So one of the ideas is about knowledge, which I'll get to. The Smart Cities mission, I don't want to say a lot about it. I'm sure you're all familiar with it, maybe more familiar than I am, because I'm not professionally working in this area. But you can see the language in describing the mission. It is that it promotes cities that provide core infrastructure and give a decent quality of life to its citizens, a clean and sustainable environment, and application of smart solutions. The focus is on sustainable and inclusive development, and the idea is to look at compact areas, create a replicable model which will act like a lighthouse to other aspiring cities. So on the face of it, it sounds like, okay, inclusion, participation, sustainability, those are all wonderful things. And then we see these sorts of diagrams. It's a little different from city to city because they've all drafted their own proposals. So it's hard to give an exact definition of what it means to be a smart city. That's an opportunity also, I think, because, that seeing the reality of one's own city, there is a potential that you could adapt some of these concepts to your own reality. So Indore, of course, has embarked on this whole project of, developing an area as a smart city, or adding elements to that area that would draw on, smart solutions. And these can include smart governance, smart transportation, smart energy and water management, smart economy, smart infrastructure, smart health and education, smart security, smart culture and heritage. So I think for all of these, the question for me is, what does it mean to be smart? And the answer I found is that one of the elements is that there's this command and control center. So this is a picture of the one in Bhopal, but we have a similar one in Indore. It looks, very impressive in the picture. But then I wonder about, so you have this centralized command and control center where you're receiving all this real-time data, and that is enabling your, civic authorities to make decisions and adjust their, patterns of governance accordingly. But as, Ash Amin, I was reading one of his books. It says that smart cities idea offers a way of imagining global and urban turbulence as governable. In this imaginary, the closely monitored, wired city has software-governed infrastructures and habitats sending large real-time data to computational systems and models able to map the complex city and generate intelligence for city leaders, systems providers, and research laboratories working with each other to continuously adjust urban governance in fitting ways. But then there's a whole host of questions about where does this data come from? And at some point in time, a decision needed to be made about which data we're going to collect. And so how was that decision made? Why was that decision made? Is this a step towards greater inclusion of people living in informal settlements in decisions about their environment and their lives? Or if not, is there a way that the collection and analysis of data could involve greater participation of ordinary citizens and not only a small group of experts and technocrats? So there's an opportunity here, which there's an emerging body of scholarship now on alternative smart urbanism that's more people-centered, that I think can enrich this vision that we have of smart cities. So going to the research that we had carried out in these two urban informal settlements, Kabutarkhana and North Tora, it was interesting to see that, as many of you have mentioned in your presentations, there's a very vibrant community life, civil society, and very close relationships of reciprocity among individuals and between the individual and the community. And they're really the biggest resource that these communities have is their people. And I think that part should not be overlooked in the haste to, evict a lot of people from slums in order to make a clean and green city and smart city, which is sometimes what is happening. This, if you see the next slide, both of these slums are located alongside the river. And that was an area when, as migrants came to the city, this was kind of a logical area for them to settle. And this is what's happened in, of course, many cities. But of course, it is the floodplain of the river. So during the rainy season, the area can get flooded. And then during the hot season, there's struggles with water shortage. And so a lot of our focus and conversation in this research was a relationship that communities had to water and to each their relation to water, each all of spiritual principles. The populations are very religious, and you see that the whole neighborhood is filled with temples and wayside shrines and dargahs and mosques and a lot of different expressions of religiosity. And so the local population seemed to find it very relevant to talk about the role of spiritual principles and beliefs in development. In particular, of the oneness of humankind, and that we're essentially with people, and also the idea of interconnectedness with the environment around us, and that we have this relationship of stewardships. This was the view here in the on the right side, confluence of two rivers, which is also considered to be very auspicious at the entrance of North Horda. And this whole area is really where the smart cities area-based development interventions are taking place, right around this area. So the communities were being affected by this process. And at one point, you can see the diagram on the right side, which has a map of the plan, the smart city plan for Kabutar Khana. So the residents a section of residents next to the river were issued eviction notices during this period while the research was going on. And not much conversation seemed to really happen between the authorities and the residents about what that meant for them. Where would they be going? What would be happening to their neighborhood? And this diagram was put up, but it's really not that clear what this means. Clearly, like, many of their homes were missing, and it shows a garden in place of where they used to live, and who is that garden for, who is actually going to use it, and what's going to happen to the life of this community that is now being evicted and resettled elsewhere, far out of the city. So the interesting thing for me is that a lot of the smart cities, what this was supposed to be citizen and participation, which did conduct one of the widest citizens consultation in the country in its preparation of the smart city proposal. There were apparently 600,000 people involved in the consultations, but only 87,000 of those people were involved in face-to-face consultation, and the rest were through apps, through the internet, social media. So that would require access to, and the 87,000 people who were involved in face meetings, those meetings took place at their hotels. So again, whose participation is really being sought when we together sit and think about the smart city? So who is supposed to live in this smart city if it's not the people of these informal settlements? Who are we making this city for? So those were some of the issues, and I'm sorry I don't have time to say much about it all, but I found some interesting alternative ideas about smart urbanism that have started to be discussed. So McFarlane and Soderstrom, there's a tendency to present the urban in smart urban as a blank canvas upon which powerful, sophisticated technology can simply be overlain and made to work in straightforwardly useful new ways. There's little genuine commitment to social and ecological justice here, and little critical thinking about how digital technologies might practically become embedded in the already existing worlds of urban life. And then McFarlane and Soderstrom allege that this idea of the smart city being, and this is not specific to India, but could be anywhere in the world really, incorporates a very thin conception of the urban. It's for corporations selling smart urbanism packages to depict the city as a flat arena awaiting their latest technological expertise, rather than as a complete complex multi-form of different political and knowledge agendas and radically needs that present profound challenges for urban social justice. What could we think of instead is maybe moving from a technology intensive to a knowledge intensive approach, which is grounded in places, actually existing cities and neighborhoods with their specific populations, resources, and problems, rather than starting from the technology. So instead of starting on the supply side, like we have this technology, so now let's try and figure out how to implement it in our city. Let's start from the side in a sense of we have the people. The people have knowledge in certain areas. They have a certain pattern of life. And if the people of these neighborhoods can read their reality and think together about how to develop these neighborhoods, then and then using the resources populations have, seeing them as people, certain resources, and then trying to, and then see how technology can augment that, maybe we would have a more inclusive process. Also, as I mentioned, that ideas about the role of spirituality can be brought in if we don't restrict our vision to only the role of science, technology, and development. We also see like this whole body of knowledge that communities have about relationships. Then see there's a wealth of things that populations talked about when we went and spoke to them. Like for example, how they actually have certain mechanisms for sharing water among the population and making sure that everyone's needs are met. And there were some really beautiful comments, like water, like the rest of nature, does not consider differences. It does not ask whose water am I, or who is drinking me or using me. Neither water, nor the air, nor the sky, or the rain, or the earth gives any regard to differences between people. It doesn't differentiate, it flows for all. Water, like air and fire, cannot be made into parts or divided. Water that flows doesn't know whether it is now in Pakistan or in Hindustan. Nobody can divide it. It is the bestowal of God. And then there were ideas about our relationship to our neighbor and how it's our moral duty to share with one another. And we really found that this went beyond boundaries of religious communities, and there was a lot of expressions of reciprocity between communities as well. I don't want to take a lot of time on that, but in conclusion, when we think of development in one way, it can lead us to, increases in exploitation, disparity, fragmentation. But if we maybe reframe our understanding of this process, then we might want to bring in the knowledge of populations that have these conceptions about our interconnectedness, relatedness with others, interdependence among people, the environment, and the city. And that could be a valuable contribution to knowledge about how to build an equitable and inclusive city. That doesn't necessarily mean that we have to forsake the technology or, the idea of smart urbanism, but it's rather to make it, something more people-centered. And again, the idea here is that technology follows the identification of resources and local knowledge rather than being dropped into the urban environment from the top down. Yeah, so I hope that was brief enough. Thank you all for your patience. And I look forward to our discussion. Thank you.
Thank you so much, Ms. Caroline Fazli, for sharing this presentation, which brought into view the knowledge that some of the assumptions with regard to knowledge, which is again a kind of something that Dr. Swami was referring to earlier, which comes from a certain worldview where development is envisioned in a certain way, and then when one actually begins to look at the subaltern perspective, at what people in the slums actually know and how they use the knowledge that is theirs for dealing with the challenges that they face, then one begins to see that there is a resource which urban policies are probably not giving adequate attention to, or maybe not even acknowledging. Since we are and I know some of you to leave, Professor 𝗏𝗏𝙗 kindly has some of the questions online which the participants had shared. Wanted to open the floor a little bit to the panelists. If you all want to share some of your thoughts on the presentations that were made, or have any remarks before we end, would be very helpful.
Arash, is all the panelists are present? Partho is here, or has he left?
He's still here, but he soon
is there. Or be around the session. Okay.
Voices.
Would you like me to say something, or do we have questions from those who registered and patiently heard us for 2.5 hours almost? Are there any questions from them? I'm sure they did not find the patience to stay for 2.5 hours.
Yes, as I was mentioning, some of the questions have been addressed by Professor Mukhopadhyay online on the Q&A option.
Okay.
But also there are other questions, like one in particular, maybe I can share with you, is thank you, Professor Kundu, for your valuable insights. By cities becoming more welcoming towards vulnerable people, are we truly welcoming people from our hearts, or is it just because of our own needs? How do we guarantee that after everything normalizes, the vulnerable will have social security?
Good question.
So a broad question. I don't know if you have any thoughts.
Let me make 1 or 2 comments. It's been a long session. Thanks to the 6 panelists led by me, who said this unhappy precedence of claiming disproportionate share in the total time, and I think all others followed my precedence, and that's how we don't have much time for discussion. But whether panelists talked about macro statistics or they tried to put face onto the statistics by bringing case studies and the field situation, I think in the context of the theme of the webinar, which is whether cities are inclusive, whether cities are welcoming for the migrants, there are 2 narratives which have come up. One is that a very straightforward explanation given, not exactly in this manner, but roughly, if I can articulate Partho's position, that yes, they went back because they don't belong to the city, right? Their belongingness is very low because of their social network in the rural areas. They have left their families behind, they have their networks, they have their land, and also part of their time that they give. And to be fair to him, he didn't really say that the belongingness is low because of the characteristics of the migrants. Also the cities, their access to drinking water and sanitation, their access to housing, their access to, the point that Pooja talked about, the access to economic activity, the streets, or their access to housing. So nonetheless, this explanation that migrants don't have a sense of belonging in the city is a factor which resulted in their exodus. The alternate perspective, I think, has been brought in by the other panelists, particularly by Siddhartha, that these people don't have the right to the city. And there is a whole struggle for these people to establish their right to the city. How, they are negotiating with the local civil society, they are trying to register their children in the school, they're having, fighting to get drinking water access, land titles. So I would think that this perspective of looking at belonging to the city in a 0-1 context is not fair. It's not an event that people belong to a place. It's a whole process. The Indians who are living in United Kingdom for generations, many of them are fighting elections, they're in local politics, but once in a while they come here. And I think about 60% of the people there are there, very much there. But there is a small percentage who keep coming, and there is nothing wrong if there is some kind of an attachment to the places of origin. And that is the case with many of the migrants. But I would like you to look at the statistics, which shows that in India, among the migrants, percentage of women have gone up significantly. Percentage of migrants bringing their family members have gone up significantly. So to say that their sense of belonging is zero in this city, they don't pay taxes. I mean, that's not the position that Partho has taken, but I know many people who say that these people have no sense of belonging to the city because they come here and use the city and then they take the money. I have a feeling they're all struggling to be part of this system, and some succeed in a different way. So I would think that the approach, the right to the city, the whole process of struggle that is going on by the interstate migrants, by the slum dwellers, and the point that Caroline brought in the city planning, are we bringing in the information of the poor, of the vulnerable? That I think is extremely important. And for all of us, I mean, the percentage of migrants who are there in the city are people from different states. They come to Delhi, they go to Bangalore, from people from Bengal, Orissa, Bihar, but once they would go back to sit. Migrants do not have a sense of belonging because of their other social cultural background would not be very fair. I have a feeling that is partly certainly true. But a large percentage of migrants who are staying for 10, 15 years would very much like to be here and like to have their rights to the city established. So I would think our focus in this webinar would be on what are the things in the city which is making their sense of belonging to be low. Their access to drinking water, sanitation, their access to stable jobs, their access to social security. These are the factors which I agree with this position that there is less sense of belonging, perhaps if you define in some mathematical formula, but that I think should be attributed to the city characteristics, and the effort should be made to ensure that cities become a little more welcoming. Institutional structure, legal structure, organizational structure, access to basic amenities become so much better that they have increased their sense of belonging. And my analysis of the labor market certainly shows that that has not gone up. Quite on the contrary, they might have weakened their sense of belonging to the city, the way the labor market changes have taken place. Well, there is some concern in the planners at the highest level. They are bringing in the statistics to have bringing registration system, but certainly that's not enough. We have to do a lot more to ensure that the people, when they come back, find the cities to be much better than what they had left behind. Thank you, Arash. I will stop here.
Thank you so much, Professor Kundu. Since we are running short of time, unfortunately, I just wanted to see if any of the other panelists have any comments to share before we conclude, maybe in the next 10 minutes. Dr. Agarwal or...
Hello?
I saw a few questions, so I've written responses also so that people can read. But some of the questions which I think Dr. Swami also referred to are about the how to do of all this negotiation, which we try to do in Indore and Agra, and we've been able to bring it in the policy so that it has been written in the policy as something which is mandated to happen. For example, the word illegal has been removed.
Mm-hmm.
So I remember when I started studying slums, there was a concept of illegal slums and slum clearance. I think the Kanpur, Professor Kundu would know better, but I think the Kanpur Slum Clearance Act was probably cited quite frequently. It was among the oldest, probably. But in this policy, illegal has been removed. So the how to is to build the community, organize them, build their confidence capacity, self-efficacy, give them the tools and skills so that they are able to negotiate in a perseverant manner, because these things cannot happen over 1 year, 2 years. That drain in Indore took us 5 years to get constructed. I mean, the bridge over the drain.
Mm-hmm.
So if we had left that in between, it would not have happened. And we should also, an NGO should not depend on donor funding to get this done, because the donor can decide to withdraw funds at any time. So then it will not happen. If you want to do it as a 2-year project and it takes 5 years, you will close it after 2 years. So these things have to be independent of donor efforts. And therefore they have to operate at budgets which can be sustained without the donor effort. So these are things which I wanted to share.
Yes, please.
Yes, sir. Thank you. Thank you. I think the part that I didn't get to talk about, which Professor Kundu just brought in, is the right to the city. Because I thought everybody is so, but I do want to say that the right, the rights aspect is the very, very critical centerpiece in this entire discourse of inclusion. And that takes struggle, that takes hard work, that takes years and years of perseverance and, the ability to, encounter defeats also in the process, right? But it's a process that has to go on. The other thing that I wanted to say, that in the larger sense, I think, the cities have never been built for the poor. Okay, and I think it's also important to understand, and this is part of the new thinking that I want us all perhaps to see if it makes sense. Cities have never been built for the poor. Cities have always been built for the affluent. So are we ready to transition, into thinking a new mode about urbanization in the 21st century, where a thriving city is also going to include empowered poor? Removing poverty is a very long-term goal, and we all are too familiar with that. But in the process, can we have some dignity? Can we have some empowerment? Can we have some basic humanity in the process, right? So the city for migrants, not city against migrants, which is the title of my talk, can we actually, now, and migrants to me here is talking about working poor and marginalized in general, so can we actually think of a resonance between city and the poor? Because historically and even contemporarily, that is not the case. We want the city never to show faces of the poor unless we see them in images, like Dr. Agarwal shares. And then we realize, yes, poor people also live in the city. So that's just what I want to say. Thank you.
Dr. Guha, any thoughts before we conclude?
Yeah, I mean, I don't have much to add, but it was really an enriching kind of a thing, because I could see that, all the speakers talked about this particular issue from different perspective. And I kind of like what Mr. Kundu just did, that is trying to triangulate, when we're talking about migrants, we are basically talking about who these people are. And that is what has been my area of contention, that should we be looking at migrants in a different manner? Should we be looking at them as outsiders? And if we do, then what is the best way to actually include them within the larger society? And I see that there are several questions on the whole idea of migration itself, the mobility. Now, this is something that it has been questioned, but something which is a reality. So we can't really say that whether migration is good or bad, but it's just a process. It's a process of mobility. The idea is, how can we include this process in our the ideas of city building, ideas of urbanization, and as Vandana just mentioned, having a political will of accepting these mobility, such mobile population. I think that is where we need to make some critical rethinking to make sure that it's not really a different group as an outsider whom we have to treat separately, but we have to create more conducive environment to actually absorb them. So that's about it.
Arash, can I take 1 minute?
Yes.
I just want to share a point with Dr. Pooja Guha, is that the sense of citizenship at a local place, or the sense of belonging, is a dynamic context. And what she brought out from her survey, that large number of these migrants say, we want to go back to our place, which is Bangalore. So it's not that they have a sense of belonging only to the village that they come from. It's something which depends on how the city is received. I just remember one interesting shot in a film called Mississippi Masala by Meera Nair. I don't know whether you have seen that. There are many Indians who are thrown out of Uganda, and they go to United States of America, and they keep on meeting. In one meeting, Shashi Kapoor, and I think Sharmila was his wife in that film, they say, I want to go back to my country. So everybody says, good that you're going back to your country. And when finally he's leaving, he said, can you take something to Bombay? He said, no, I'm going back to Uganda. Uganda is my country. I live there. So, you can't say that things are remaining stable over time. That's the point I wanted to make. And I think all of us thought that the migrants are really struggling to establish their identity in the urban area, the right to be there through various methods. And let us try to strengthen that process. Thank you.
Maybe the last question. There is a question to Caroline, which says, with the example of Indore Smart City, you've pointed out that it is important to first understand our perceptions of development that largely drive what we do. Could you talk about a few policy or behavioral change tools that we can use to correct our perceptions, both government and public?
I would actually be interested in hearing what you all have to say about this, because I'm not an expert in any sense, but I think part of it is what we're doing today also, is that we can engage in discourse, we can engage in conversation about some of these fundamental assumptions, and we can do that in different spaces. So this is one space, but of course there are many spaces at the local level, like at the level of a neighborhood or at the level of a city, or in educational institutions, in other workplaces that we're involved in. I think just having conversations where we actually discuss some of these assumptions, and then that is an opportunity to reframe conceptions. Yeah, I don't know what others think.
Does anyone else want to respond to that question?
She has been very modest, and I think these are questions which all of us are in a way trying to find answers, and to take a big amount of research to come to any definitive evidence.
So, friends, thanks to everyone for this very enriching and thought-provoking webinar. I'm sure we leave with many new insights, perhaps not clear answers, but at least we have an indication of new ways of thinking and action, which seem to point to a path towards creating more just, inclusive cities. At least the thinking is advanced in this sense. The Bahá'í Chair is very grateful to all the panelists, and of course to the very patient participants. And I apologize if not all the questions were answered. I think many of the panelists have responded to the questions that were directed to them. But we will try to make sure that there is time even after we conclude, that if panelists want to look at the questions and send their responses, they can do that. As I mentioned at the beginning, this is a series of webinars. The next one will be on looking at the rural perspective, and to look at the question of the labor absorption capacity of the rural economy, and we hope to explore that in some detail. And we hope to see all of you, dear ones, during that webinar as well, which we will be sure to inform you about soon.
Okay, great.